Continuing to the third common injury that we'll be looking at is the meniscus tear of the knee. The meniscus is a tear of the tissue found in between the knee joint. The tissue can be worn down and degenerated over time, leaving the tissue vulnerable to tearing under the flexing and rotating forces of a knee. Um, this can occur because of chronic wear and tear, or because of an acute incident. Athletes like catchers in baseball are the ones that are most prone to injuring the meniscus. The anatomy of the meniscus. This is meant to provide the knee joint with an area for the surface of the proximal head of the tibia to glide against the distal head of the femur without causing a painful friction along the bones. Meniscus also aids in a shock absorption after acute forces are created from running or jumping. When the knee is put um, under a forceful abduction and rotating motion while the leg is weight bearing, a medial or lateral meniscus tear may result depending on internal or external rotations. This happens for baseball catchers when they perform that lateral blocking motion, especially when they're under that like deep maximal flexion of the knee. Um, the hyperflexion puts a compromising variable for a tear in the meniscus to happen. McMurray's test is a good test to assess the state of the meniscus in the knee. The patient will be in its end range of flexion in the knee, and the athletic trainer will either internally or externally rotate the knee. The knee will then be brought into extension with the assessor holding the tibia in the rotated position. Positive tests will indicate a painful crepitus in the knee. If this occurs, then an MRI needs to be administered to see the extent of the injury in the meniscus. The usual treatment for a meniscus tear is arthroscopic surgery, which is used to cut out the damaged tissue in the meniscus or to smooth the loose flap of the meniscus that's causing the pain. The meniscus generally has to be removed because the area is like it lacks a lot of viscosity or has very low blood supply, and it will not regenerate. Cutting out the tissue will slow the degeneration of the process, but quicker degeneration will occur now that that part of the meniscus is gone in comparison to pre-injury. Preventative exercises for your meniscus are straight leg raises. This reinforces that proper activation of the quadricep muscles that help support the knee. This is executed by an athlete lying prone in a supine position on the floor, and they'll extend their knee in an isometric contraction of the quadricep. They'll then take their hip through the end range of flexion while maintaining the extension of the knee through the sagittal plane. If the athlete has flexion in their knee or loses the extension, could be a result of either weakness in the quadricep or pain that they're experiencing in the knee. Performing this for about 2 to 3 sets, 10 to 15 repetitions, which is in that strength to endurance rep range, 3 to 4 times out of the week will be adequate for preventative measures of the meniscus tear. Progression from this to increase the progressive overload and increase the core stability, you can attach a TheraBand and perform this exercise from the standing position rather than the supine position on the floor. Again, sets in between 2 to 3 sets for proper activation of your quadricep are adequate at that 10 to 15 rep range, which will help build that strength and muscular endurance around 3 to 4 times out of the week. Preventative exercises for your meniscus tear will also be the single leg squat touchdowns. The purpose of this is to build muscles that encompass the entire thigh, which helps support the knee. This is going to improve your body's proprioception because they're balancing on one leg during this exercise. They're going to stand on an elevated surface while one leg eccentrically flexes and controls the other leg as it descends and touches the heel to the floor, and then concentrically will extend the knee to bring the rest of the body back up to the elevated surface. Common faults you'll see with this, as they're taking their leg down, the hips will rotate to decrease the range of motion in flexion of the knee needed to touch the floor. This either indicates bad core stability, pain that they're compensating for, or lack of strength in the thigh muscles. Also noted that the hamstring muscles in the back and the gluteus muscles activate during this exercise to stabilize for the concentric and eccentric actions of the quadricep. 2 to 3 sets at around 6 to 10 repetitions. This is that strength hypertrophy range. We're improving strength and trying to build the muscle, because a bigger muscle is a stronger muscle. Doing this 3 times a week out of the week will be good. Doing more than this, you might be overtraining that area. Progression from this is the plyo depth jumps. Now that we've worked the slow muscle twitch fibers, we want to recruit those fast twitch muscle fibers that stimulate that neuromuscular adaptation for this stretch shortening cycle. From an elevated surface, the athlete will loosely step off the elevated surface and absorb the landing on both feet while simultaneously executing a squat jump. The quicker the athlete gets back off the ground from landing, the more efficient their stretch cycle in their quadricep muscles, or in the muscles in their thigh, will be able to work. If the athlete is stopping between the landing and jumping phase, then they're not adequately exercising that stretch shortening cycle needed to be a plyometric movement. Because this is a plyometric movement or a power movement, there'll be longer rest periods in between sets, 4 to 6 sets, and there'll be lower repetitions in between 6 to 8 repetitions, which is that strength and like power recruitment rep range. Performing this 3 times a week will be adequate. Anything more, you may stress your central nervous system too much or overtrain your legs. Rehabilitative exercises for your meniscus incorporate the agility dot drill, which creates those valgus and torsion forces created in sport. It'll increase the athlete's agility, balance, and proprioception. This is executed with an athlete jumping from one dot to the next on a 5-dot mat that resembles that of the 5 dots on a dice. Figure 8s and hourglass formations are best for valgus and torsion forces. If the athlete is missing their landmarks or missing the dots, this is because they either they have a low proprioception threshold, or they lack muscular endurance. 2 to 3 sets, and the sets will be quantified in time because of the quick oscillations. 15 to 30 seconds will be adequate stimulation at about 3 to 4 times per week, allowing adequate time for rest and recovery. Progression from this, the athlete will perform the agility dot drill on one leg. This is going to increase the balance and increase the intensity of the valgus and torsion forces on the knee. You'll perform the same jumping formations, but because it's single leg, it resembles the stress that athletes go through during their pivots on single legs during sports. Missing landmarks will indicate that they're not ready for this progression and have to perform them with 2 legs again. 2 to 3 sets, again, sets quantified in time for 15 to 30 seconds, 3 to 4 times out of the week. Another rehabilitative exercise that can be performed for the meniscus tear of the knee are banded quad extensions. This will reintroduce that activation to the quadricep muscles, specifically the vastus medialis, which will provide the greatest amount of support for your meniscus or your medial meniscus, which is the most commonly injured meniscus. Execution, you're going to hook a TheraBand around the posterior aspect of the knee and also to a stable surface in front of the body. Then with the tension of the band, you're going to flex the knee at about 90 degrees or a little bit less, resembling that of a lunge position, but you're going to concentrically activate the quadricep muscle against the resistance of the TheraBand and then eccentrically guide it back in your knee into flexion. Performing a lunge instead of knee extension is a common fault in this exercise. You're going to do this for about 3 to 4 sets at 10 to 15 repetitions, again being in that strength and muscular endurance rep range 3 to 4 times out of the week. Progressing from the banded quad extensions, you can begin activating the quad through dynamic lateral motion with the lateral step-ups. The person will stand laterally to an elevated surface and begin hip and knee flexion to initiate the motion, and then the hip abducts to reach the elevated surface. The knee will then and hip will extend concentrically to lift the rest of the body up, and then in reverse order will eccentrically take the body back down. An athlete may push off of the other leg in order to compensate for the resistance of the concentric phase of this exercise, which is a common fault that needs to be watched out for. 3 to 4 sets performed in 6 to 10 repetitions, which is that strength hypertrophy range, with making sure that the athlete has adequate intensity for these rep ranges. 3 times out of the week will be sufficient. This has been my presentation on the 3 common injuries in professional baseball. Thank you very much.